Deep within the human psyche lies a realm where reality blurs and imagination takes hold. It is a place where ancient fears and mythical creatures intertwine, where the line between man and beast becomes indistinguishable. In this shadowy realm, we encounter a rare and perplexing condition known as clinical lycanthropy. Imagine the chilling sensation of your own body transforming, your senses heightened, and an unquenchable thirst for raw flesh consuming your very being. This is the terrifying reality for those afflicted by this enigmatic disorder. For centuries, tales of werewolves have captivated and terrified cultures worldwide. From the ancient myths of Greece and Rome to the folklore of medieval Europe, these half-human, half-animal creatures have haunted our collective imagination. Join us as we delve into the depths of clinical lycanthropy, exploring its symptoms, historical context, and modern treatment approaches. Prepare to be both fascinated and disturbed as we unravel the mysteries of this enigmatic condition. Clinical lycanthropy, from the Greek words lykos, wolf, and anthropos, man, is a rare psychiatric syndrome characterized by a delusional belief. Individuals believe they are transforming into an animal, most commonly a wolf. Historical and modern cases report transformations into various animals. Clinical lycanthropy is a disorder of self-perception and reality testing. The exact causes remain shrouded in mystery. Researchers believe it involves biological, psychological, and social factors. Imagine the world through the eyes of someone with clinical lycanthropy, a world where the boundaries of your own body blur. Animalistic instincts take over. The experience is as varied as the individual's. Hallmark symptom: belief in transforming into an animal, accompanied by vivid hallucinations. They may see fur sprouting from their skin, feel claws extending from their fingertips, or hear a growl rumbling deep within. Behavioral changes mirror the believed animal form, howling at the moon, crawling on all fours, engaging in predatory behaviors. The emotional landscape is turbulent and distressing, intense fear, anxiety, and confusion. Understanding these experiences is essential for compassionate treatment. The roots of clinical lycanthropy wind back through centuries, entangled with folklore and superstition. Ancient texts mention individuals believing themselves possessed by animal spirits. In the Middle Ages, such individuals were often accused of being werewolves. Peter Stube, a 16th century German farmer, was accused of being a werewolf. By the 18th century, clinical lycanthropy shifted from superstition to medicine. Dr. David Cohen's research in the 70s provided valuable insights into this disorder. Section 5. Modern Medicine's Approach, Diagnosis and Treatment. In the 21st century, clinical lycanthropy is no longer viewed through the lens of superstition or demonic possession. Instead, it is recognized as a complex psychiatric syndrome, requiring compassionate and comprehensive treatment. Diagnosing clinical lycanthropy involves a multifaceted approach, relying heavily on the individual's self-reported experiences, observations of their behavior, and a thorough assessment of their mental and physical health. Psychiatrists and other mental health professionals use a combination of interviews, questionnaires, and psychological tests to evaluate an individual suspected of having clinical lycanthropy. It's crucial to rule out other potential causes for the individual's symptoms, such as substance abuse, brain injuries, or other underlying mental health conditions. Once a diagnosis of clinical lycanthropy is established, treatment typically focuses on addressing the underlying psychological factors contributing to the delusion. Antipsychotic medications are often prescribed to help manage hallucinations, delusions, and other psychotic symptoms. Cognitive behavioral therapy, or CBT, is often employed to challenge and reframe distorted thoughts and beliefs associated with the delusion. In some cases, a combination of medication, therapy, and lifestyle modifications may be recommended to address the individual's overall well-being. Section 6. The importance of early intervention and support. As with many mental health conditions, early intervention and support play a crucial role in improving outcomes for individuals with clinical lycanthropy. Recognizing the symptoms early and seeking professional help can significantly increase the effectiveness of treatment and minimize the impact on the individual's life. Family and friends can play a vital role in supporting their loved one through this challenging experience. Educating themselves about clinical lycanthropy, understanding its symptoms, and learning how to respond with empathy and patience are essential steps in providing effective support. Creating a safe and supportive environment for the individual is crucial. encouraging the individual to engage in treatment and adhere to their medication regimen is also essential for their recovery. Reducing stigma, promoting open dialogue about mental illness, and ensuring access to quality mental health care are crucial steps in supporting individuals with clinical lycanthropy and other mental health conditions. Section 7. Dispelling myths and reducing stigma. Clinical lycanthropy, despite its rarity, has long been shrouded in myth, fear, and misunderstanding. Sensationalized portrayals in literature, film, and popular culture have often perpetuated harmful stereotypes, associating the condition with violence, aggression, and supernatural forces. These misconceptions only serve to increase the stigma surrounding mental illness and prevent individuals from seeking the help they need. It's crucial to remember that individuals with clinical lycanthropy are not monsters or dangerous creatures. They are individuals grappling with a complex mental health condition that significantly impacts their thoughts, feelings, and behaviors. Dispelling myths and reducing stigma begins with education. By increasing public awareness about clinical lycanthropy, its symptoms, and its treatment, we can foster greater understanding and empathy for those affected. Section 8. Beyond lycanthropy, understanding mental health. While clinical lycanthropy remains a rare and intriguing condition, it serves as a powerful reminder of the complexities of the human mind and the importance of mental health awareness. Just as our physical health requires care and attention, so too does our mental well-being. Mental health conditions can manifest in countless ways, affecting our thoughts, emotions, behaviors, and overall quality of life. Understanding the spectrum of mental health, from common conditions like anxiety and depression to rarer disorders like clinical lycanthropy, is crucial for creating a more compassionate and supportive society. By recognizing the signs and symptoms of mental illness, we can encourage individuals to seek help when they need it most and reduce the stigma surrounding these conditions. Investing in mental health resources not only benefits individuals experiencing mental illness but also strengthens our communities as a whole. Section 9. A brighter future, hope and recovery. While clinical lycanthropy presents unique challenges, it's important to remember that recovery is possible. With appropriate treatment, support, and a commitment to their well-being, individuals with this condition can lead fulfilling and meaningful lives. The journey towards recovery may be long and challenging, but it is ultimately a journey of hope and resilience. As we continue to unravel the mysteries of the human mind and expand our understanding of mental health, we pave the way for more effective treatments, greater compassion, and a brighter future for those living with clinical lycanthropy and other mental health conditions. Let us move forward with empathy, knowledge, and a shared commitment to creating a world where everyone feels supported, understood, and empowered to live their lives to the fullest.